Dr. McKay, good afternoon. Welcome. Are you well, sir? Are you okay now?
I'm much better, thanks, Dan. I'm recovering. I'm currently on day 11 post-isolation and since the beginning of my symptoms, so I'm feeling a lot better, thank you.
Okay. When did you get the jab?
On the 24th of February, 2021, the J&J vaccine, I received it at Baragwanath Hospital.
And when did you get sick?
I started with mild flu-like symptoms early last week, and by Thursday night I had a very bad night with my chest. Friday morning, woke up, couldn't taste or smell a thing, and went to be tested, and I received my results on Friday afternoon to say that the PCR is positive for COVID-19.
After how long did you get infected since you took the jab?
So this is exactly about just over 4 months since receiving the jab.
So we are told the J&J is a one-size-fits-all jab, so to speak. You only need it once and you should be okay. The effectiveness of it is around 70% or so. So there's a 30% chance you might get it. So you fell into that 30%?
Well, absolutely. And I think this is the main message, that we need to move away from this expectation that having the vaccine does not guarantee you 100% reduction in risk of getting COVID. The real protection is in the reduction in hospitalization, severe illness, death and dying. And so I'm not put off. I'm not disappointed at all. I'm at the forefront. I'm currently running well over 100 active COVID patients. I've been at the forefront every single day. I've been meticulous with my non-pharmaceutical interventions, and I still got COVID. And over and above that, Dan, I don't know if you know, my wife works with us in the practice. She has also been vaccinated, and I happen to pass on COVID to my wife as well, who has also been vaccinated.
How is she now?
She's also much better. She's just a few days behind me, so she'll be day 10 will be on Monday, God willing. And we're okay. I shudder to think what would have happened had I not been vaccinated, based on just how I've been feeling over the last few days.
That was going to be my next question, Doctor, to say, you said there was one particular night when you had a terrible chest experience or breathing experience, but you believe, from a medical perspective and your experience, that it could have been worse if you didn't have the jab in February.
Absolutely. There have been times where my oxygen saturations have dipped just under 90%. We have had extreme chest pain. We have been battling to breathe, severely congested, shortness of breath, all these typical scary things that warrant urgent referral to a healthcare facility. And just knowing that I've had the jab has calmed me down sufficiently to know, just do some breathing exercises, get your medication on board. You're going to be okay because you have the vaccine. And that sense of peace is just amazing.
Yeah. What is the medication?
So the medication that we use is a combination of, obviously, most people are using the vitamin D, the C, the magnesium, the zinc, medication to thin the mucus. But we have a combination of medication that has been shown to have good results in terms of preventing COVID pneumonia and preventing lung clots that can also be a complication of the severe illness with COVID. So we put together a regimen of treatment that has excellent results. In my practice, and together with the specialists that we work with, that reduce the severity of illness and basically keep people out of hospital, Dan.
Yeah, I'm getting a little bit angry when you're talking, when I hear people talking about, oh no, but we're getting vaccinated, we're going to be fine, it's okay. But your experience, and you're a medical practitioner, you got the Johnson & Johnson jab, the one-time jab in February. You got sick just a couple of weeks ago, and it helped you, it saved your life. But it shows that even with a vaccine, you're not safe from getting infected. So you need to wear your mask, sanitize your hands, wash your hands, social distance, don't attend gatherings. So all of those non-pharmaceutical interventions remain relevant and important.
Absolutely. And it's going to remain relevant and important until those very naysayers get vaccinated. Because the only holdup to us coming to a point in our lives where we can start relaxing some of those non-pharmaceutical interventions is when more and more people are vaccinated. So people are saying, well, doc, you got vaccinated, yet you got sick, so why should I vaccinate? It's exactly for that reason, because if you also got vaccinated, there's a lower chance of all of us becoming infected with the vaccine. So the more of us who join in and get vaccinated, the better the protection for all of us.
And that will go with another appeal, I guess, if I ask you that question. Yes, we want to get vaccinated, but there are no vaccines available at the moment. That Johnson & Johnson was stopped by the American FDA, but we understand from next week we might be getting doses on our shores via the Johnson & Johnson production facility in Europe. So you would also urge the government to secure supply.
Secure supply, ASAP, secure as much supply. And at the end of the day, it does not even matter which vaccine. A vaccine is still going to work. The various percentages may be different, 66%, 70%, it doesn't matter. At least we know with the vaccine on board, you're not going to die. You still get it, but you have that protection.
And you are a living proof of that, having got the J&J jab in February, you and your wife, and was also recovering. And thanks to that jab, you've managed to pull through. You keep on counting the days. Why do we say day 10, day 11? Why is the counting of the days important as we conclude, Doctor?
So the days of, remember when you are sick, you go into isolation and you count from day one or the first day that you started presenting with symptoms. Because in that time, those first 10 days are when you are most infectious. We know that by day 9, day 10, 11, the amount of virus that you're carrying is much lower and therefore not enough to transmit to somebody else. So it's vital for those first 10 days that you are ill to remain in isolation, locked up indoors. We are currently locked up in our bedroom here so that we can limit the spread. From day 11, 12, even though you may not feel 100% better, at least you know you are no longer infectious and it's safe to come out of your room.
Dr. McKay, thank you very much for sharing your experience, your lived experience as a medical practitioner who got the jab, the J&J jab in February, but still got infected with the virus. But as you saw him there, he's recovering now in day 11. He had one or two scary moments, but he believes without the jab it could have been worse.